Hello there, let's do some cardio prep based on this topic. So we're gonna try and solve past paper questions, and hopefully that will help us a long way in understanding what the topic we're dealing with is and how it can help us to understand the topic better. Okay, so let's look at question 1. So question 1 is, what is the definition of this Dyslipidaemia? So what is the definition of this? And the definition of this is, it is the presence of abnormal lipid levels in the blood, including elevated LDL cholesterol, elevated triglycerides, reduced HDL cholesterol, or a combination of these abnormalities. Now let's look at question 2. So question 2, which lipid reduction has the strongest evidence for cardiovascular benefit? And the answer for this would be, that the strongest evidence supports lowering LDL cholesterol. LDL is directly involved in Atherosclerosis, and reducing LDL significantly lowers the risk of heart attacks, strokes, and cardiovascular death. So that's the cardiovascular benefit. Now we're looking at question 3. So question 3, what is the primary function of cholesterol? And the answer to question 3 will be, cholesterol has 3 important functions: structural component of cell membranes, precursor for steroid hormones, precursor for bile acids. Question 4, what is the primary function of triglycerides? Triglycerides, as you know, are the body's main energy storage molecule. During periods of energy demand, they're broken down into fatty acids and glycerol to produce ATP. Now let's look at question 5. So question 5, why are cholesterol and triglycerides transported by lipoproteins? So why cholesterol and triglycerides transported by lipoproteins? And the answer for that is, cholesterol and triglycerides are water insoluble and cannot travel freely in plasma. And lipoproteins act as a transport vehicle, allowing these lipids to circulate in the bloodstream. Let's look at question 6. So what are the 3 components of the outer layer of a lipoprotein? And those 3 components will be free cholesterol, phospholipids, apolipoproteins, and these components form a hydrophilic surface that allows transport through plasma. Let's look at question 7. So question 7, what is the function of apolipoproteins? And the answer is that apolipoproteins have 3 major functions: provide structural support, act as enzyme cofactors, function as receptor ligands for lipoprotein uptake and clearance. And question 8, how are lipoproteins classified? So how are they classified? The answer for that is, lipoproteins are classified according to their density and size. As density increases, particle size decreases. So there's Chylomicrons, VLDL, LDL, and HDL. Question 9, what is the role of chylomicrons? So chylomicrons are responsible for transporting dietary lipids from the intestine. They deliver triglycerides into tissue, and the remaining chylomicron remnants are removed by the liver. Now let's look at question 10. So question 10, what is the most important enzyme in lipoprotein metabolism? So the key enzyme in lipoprotein lipase, LPL, hydrolyzes triglycerides in chylomicrons and VLDL, releasing free fatty acids for tissue use. Now let's look at question 11. So question 11, what is the major cholesterol carrier in plasma? The major cholesterol carrier is LDL, low density lipoprotein. So LDL delivers cholesterol to peripheral tissue and is the principal atherogenic lipoprotein. Now let's look at question 12. So question 12, what is the main determinant of LDL levels? The primary determinant is LDL receptor activity in the liver. More LDL receptors result in greater LDL clearance and lower plasma LDL levels. Let's look at question 13. What is reverse cholesterol transport? So reverse cholesterol transport is the process by which HDL removes excess cholesterol from peripheral tissues and returns it to the liver for disposal. This is an important anti-atherosclerotic mechanism. What is type 1 hyperlipoproteinemia? So type 1 of that long word is characterized by elevated chylomicrons, severe hypertriglyceridemia, and it is usually caused by LPL deficiency and may present with pancreatitis and eruptive xanthomas. Now let's look at question 15. Question 15. What are the two major causes of dyslipidemia? So there are two broad categories: primary dyslipidemia, and those are genetic causes. Example, familial hypercholesterolemia. And then the secondary dyslipidemia, and that's acquired causes. Examples of this would be obesity, diabetes mellitus, hypothyroidism, poor diet, alcohol use, and possibly medication. Okay, thank you for watching. Hope this made it slightly easier. Thank you. Bye.